Thank you, Meredith. Okay, so I'm Meredith. I'm a physiotherapist who works up here at Royal North Shore, mostly in pulmonary and heart failure rehabilitation. And prior to that, I was working over with Dr. Collier at St Vincent's in the transplant unit and on the wards there. So, good topic while everyone's eating lunch. I'm going to talk about a bit of a dirty word, which is exercise. So, show of hands, who here in the room does some sort of regular exercise? Few, not bad. So, for a long time people said for pulmonary hypertension that exercise was not a good idea. But now there's a growing bunch of evidence that it can be done, but you've got to be a bit sensitive about what you do, and a few guidelines about how best to exercise and what's safest for you. So I'll skip through this part a bit because Eugene's talked about it in more detail. But as we know, we breathe in to get oxygen to our blood. And basically the left side of your heart pumps that blood to all your muscles and to all your organs. And as the blood delivers the oxygen to your muscles, it also collects the waste products, which is carbon dioxide, urea and a few other chemicals. The blood then returns to the right side of your heart to go back to your lungs to collect more oxygen. And the blood vessels in your lungs go around the little air sacs, which we call the alveoli. The alveoli are really thin, so it's easy for them to get the oxygen across into your blood. And also the carbon dioxide then comes back out of your blood into your lungs, and you breathe out that carbon dioxide. But in pulmonary hypertension, this process doesn't work as well as it normally should. So we get changes to those blood vessels in your lungs, causing a higher blood pressure, and that increases the work on the right side of your heart to get that blood into your lungs to collect that oxygen. So in pulmonary hypertension, you've got less blood flow through those blood vessels and a higher resistance, so it's harder work. And you've also got thickening of the blood vessel walls, which means that you've got a thicker barrier for the oxygen and the carbon dioxide to get across, to get in and out of your lungs. So, why is exercise hard when you've got pulmonary arterial hypertension? There's lots of factors, and some of them are specific to the disease, and some of them are specific from what happens when you don't exercise for long periods of time. So, as Eugene mentioned, we've got increased work of the right side of your heart. You've got thicker blood vessel walls that make it harder for your body to get the oxygen in and get the carbon dioxide out. This then affects the left side of your heart's ability to pump that blood around the rest of your body. And you've also, your muscles become a bit inefficient, so they're not as good at using the oxygen that they're getting. So some common symptoms when you're exercising, you've got PAH, breathlessness, fatigue, dizziness, and over periods of time, if you're avoiding exercise, when you next go to do something, it's harder because your muscles become weaker and more deconditioned. And an important thing to remember in PAH is the results of your medical investigations and the tests that you have don't necessarily correlate with how fit you are. So we'll often see people whose results are what we describe as really poor, but they're functioning and getting around more than somebody who is on paper looks more well, but is less active. And that comes from this muscle weakness and your body's general fitness. And that's something that with exercise you can work on and improve on. So as I mentioned, your muscles being weak, they become less efficient. So they don't use their oxygen as well. You sort of run out of steam more quickly. And as a result, that tells your brain, I need more oxygen, I need more blood flow. So your heart tries to pump harder, tries to get more blood and oxygen to the muscles, which puts more strain on your heart. And in pulmonary hypertension, because your heart's already having a hard time, it can't necessarily keep up with that demand, which makes you feel more breathless, more dizzy, feeling really unwell. Also, when your muscles are less efficient, they create more waste. So who knows the feeling when you've exercised, you get that aching feeling in your muscles. So people call it lactic acid, but it's basically the feeling where your muscles are building up waste products. And some of those waste products are things like carbon dioxide. And carbon dioxide is important because more carbon dioxide in the muscles also tells your brain, I need more oxygen, I need to breathe more quickly to get rid of the carbon dioxide. So it all goes together to make you feel more breathless, doing less activity than you used to do. So, and with gentle exercise, your muscles become better at using the oxygen that they're getting and more efficient, and they produce less of that carbon dioxide. So you'll feel less breathless when you're exercising, despite the fact that your pulmonary hypertension might not have changed. However, information that you see or read about exercise doesn't necessarily apply completely to people with PAH. So the Heart Foundation guidelines is every adult should do 150 minutes of exercise a week. Well, I'm sure some of the people in the room will say that is absolutely not possible. And you've got to be sensible about taking these guidelines and working them into your own life and what's appropriate for you. And any new activity or exercise program should be discussed with your specialists and anyone else who's involved in your care to give you some guidance about how much you should be doing and what's appropriate for you. So, has anyone in the room done a hospital-based exercise program? Good, a few of you, perfect. So I recommend for most people that's the best place to start, and we'll talk a bit more about how to find them. So, gentle exercise and light to moderate exercise will benefit your muscular strength, make your body more efficient, and should, if you're picking the right exercise, make your daily activities or things that you enjoy doing easier. However, if you're exercising too hard, you may be putting your heart and lungs under that additional strain. So we've got to find a happy medium. What we generally recommend for people with PAH is that we should be doing light to moderate exercise, which, if we look at our 1 to 10 scale, if 0 is absolutely not fatigued, not breathless at all, and 10 is exhausted, we want you to be at about a 2 to 3, which should correlate to you feeling puffed, but you should still be able to talk in full sentences. So if you're getting to that point where you can't talk or you're really puffing, stop, have a rest, and get back to it later. And that might mean when you start exercising, you need to do smaller portions, and as your fitness improves, increase what you're doing. So for most people, as I said, we recommend starting with a more formal exercise program. Most of the hospitals run either pulmonary or cardiac rehabilitation programs, and they're programs where they'll get you into the hospital between 1 to 3 times a week for 8 to 12 weeks and do a specialised exercise program for you based on what your fitness is like and what you'd want to get better at. And you attend the exercise sessions, they've got oxygen and heart rate monitoring there if you need it. And when they realise what's safe for you to do and what you're enjoying doing, we also tend to give you a bit of a home program for you to do on the days that you're not coming. And we also run education sessions about how your medications work, healthy diet, conserving your energy and things like that. And it's quite a good supportive environment because everyone else in the group is breathless as well. So depending on what your local hospital is, will depend whether they want, because PAH falls into that category of a little bit of lungs and a little bit of heart, it depends on the hospital where they think you'd benefit, as whether you join a pulmonary group, which is with people who have emphysema, asthma, other lung conditions, or the cardiac rehab group. And some hospitals will have a specialised heart failure group, which might be more appropriate. So, a few ideas I thought I'd give you about basic types of exercise you can start off with. The first type is aerobic exercise, an exercise that gets your whole body moving and is quite functional. So starting off, depending on what you're able to do, and building up to longer periods. So some people, we might tell them just to start off with, just aim to walk from the front door to the mailbox 3 times a day, and starting off there and building it up as people are finding that they're not getting as breathless, not getting as tired. Rest as often as you need to. When you start to feel more than that 3 out of 10 shortness of breath or fatigue. So next lot is functional exercises for your legs. So we want you to pick exercises that are going to make your day-to-day activities easier. So the most common things we get people to start with is sit-to-stands, which is basically, like it sounds, standing up from the chair and sitting back down. It's a really good exercise for your thigh muscles and for the muscles in your bottom. I'm not going to make everyone do it now because you're all still eating lunch, but I was going to. and the other one is a step up, so basically up and down one step. Again, really good for your thigh muscles, and it's something that you come across when you're out and about. If you find it too easy, you can do things like not using your arms, or you can hold a little weight while you do it if you want to make it more challenging. And generally we tell people to start off doing, say, 2 or 3 at a time, and when that gets easier, increasing the numbers you're doing, rather than making it heavier and harder for yourself. It's really important not to hold your breath when you're doing exercises, because that impedes the blood flow back to your heart, because you're increasing the pressure in your rib cage, and that'll make you feel more dizzy. So rest as often as you need to with the exercises. I'll often tell people to do this type of exercise, during an ad break of your favourite show. It can be done anywhere, and you can just do a few, then next ad break you can do a few again. And you're always best to pick, as I said, exercises that relate to your function, and exercises that focus on your big muscle groups. Arm exercises, again, much the same idea. We want light weights, because if you're using really heavy weights, like if you ever see the weightlifters, they all hold their breath. And in PAH, that might make you pass out, so we don't want to do that. So light weights can be, a tin of baked beans, a little water bottle, if you don't have little dumbbells. Start with a few repetitions and then increase the number as needed, rather than increasing the weight. So we generally tell people to aim to do 3 batches of 6 of each exercise before they even think about making the weight heavier. Focus on your large muscle groups, so the muscles in your shoulders, your biceps and triceps, and also your elbows. If you've got shoulder problems, just work within whatever's comfortable. A lot of people find they get pain when their arms are higher than shoulder height. So if that's the case for you, just do things down lower. And again, making sure you don't hold your breath. So, some other types of exercise I thought I'd mention, because some of those exercises aren't very exciting for people. So picking exercises that you enjoy and that also relate to what you want to do. So balance exercises are really good. There's growing amount of research now for Tai Chi in people who are breathless, because it's a good exercise. You control your breathing while you're doing the movements. And also social sports like aquarobics, bowls, whatever you enjoy doing. And sometimes it might be a matter of, reducing the duration of what you're doing, but you can still go along, big part of it. I recently had somebody who really wanted to be able to go and participate in their old line dancing class. So we gave her some exercises that helped her build the strength up so she could participate in even just little bits at a time, but you're still getting that social support, and you're much more likely to exercise when you're having fun. So, some other general guidelines, which is, pretty common sense, but sometimes people forget. So don't exercise to the point where you can't talk, where you feel lightheaded, you're more than that moderately short of breath, or you have chest pain, or you're feeling palpitations. These are signs that your heart and lungs are really working too hard. And if you experience any of these things, sit down, have a rest, let yourself recover. But if it's happening quite frequently, or you're not able to recover from it, discuss it with your medical team. Don't exercise if you're feeling unwell, like you've got a cold, or if your medical condition has really changed, you might need to start off with something lower before you get back to your old routine. Don't exercise straight after meals, because generally it makes you feel nauseous. Try and avoid lifting heavy objects, picking heavy bags and things up, again because generally you'll try and hold your breath, which makes things harder. And don't exercise when it's really hot, really cold, really smoky like it has been recently. In terms of things to do for exercise, it's really important that you pick the time of day or the place for exercise that works best for you. Some people find that first thing in the morning is the best thing, and that's what you should be working on. Find something that you enjoy and find something that relates to what you want to do. And often it's a really good way to do it if you find some friends who have similar interests and give it a go in a bit of a social setting, because you're much more likely to have fun, have a bit of a chat, and also more likely to continue on with your exercise. So always, before you start a new program, talk about it with your specialist. And if, as I said, if you're noticing any symptoms that are worse than normal, talk to your doctor about it and get it looked at. So in terms of where to find exercise programs, as I said, most of your local hospitals will do it. But if you're having trouble finding something, ask your specialist, because they normally have a long list of programs. And if you live outside a metropolitan area, talk to your GP, because most of even the rural hospitals will offer something. And also the Lung Foundation Australia website has a huge list of what's where, and they can get you in contact with your local programs. And also, if anyone has any questions, I can help link you in as well. Some of the hospitals were nice enough to send me their brochures, so I've got a few, but I can also track down anything else if people are from other areas. A final point with the rehab sort of programs, most of them also run their own versions of support groups and walking groups that sort of ongoing support. Even if it's not pulmonary hypertension specific, you'll still be around a group of people who have some sort of chronic disease. And it's a good way just to have that social aspect and, talk amongst yourselves about ways to cope and little tips and tricks along the way. So last point, you might have seen I dropped some brochures on most of the tables during lunch. And that's because James asked me to make a little point about dietary guidelines. So earlier this year, there was the new Australian Dietary Guidelines. And as a physio, I loved these because their first point was be physically active. The other summary points were to eat a variety of foods from your 5 food groups. And on the brochures, there's lists of how much of each food group you should be having a day and what a serving is, because it can be a bit confusing. Limit foods with high sugar, high saturated fat, and high amounts of alcohol, because alcohol is full of sugar. Support breastfeeding if you're in that situation, and prepare and store your food safely. In terms of fluids, some of you are probably on a fluid restriction, so if that's the case, stick to the fluid restriction as prescribed by your doctor. But if you're not, the guidelines that say 1.5 to 2 litres of fluid that doesn't have caffeine in it. Because caffeine is a diuretic, it actually, for your fluid intake, for every cup of coffee you have, you're meant to have another cup of non-caffeinated fluid just to come out at even. So coffee and tea doesn't count towards your fluid. And if you have any specific questions, talk to your GP or a dietitian about getting a specific plan. And again, if anyone wants more information about that, I'm happy to email some stuff around that goes into more detail, but I thought that was probably a talk in its own. So, any questions? Everyone probably needs a nap after lunch. So we generally will tell people to do mixtures of exercises. So if I give someone a program, we'll give them a little bit of legs on a certain day and a little bit of arms, rather than doing heavy things with both. And generally things that for aerobic exercise, because some aerobic exercise like rowers and things sort of really work both your upper body and lower body heavily at the same time. So generally we stick to exercise that's more functional, so you're walking. Cycling's a good one because your arms aren't doing much and your legs are doing all the work and it's still getting the blood pumping. But certainly sticking to things where it's more functional and you're not exhausting your whole body at once, because it does overly fatigue you.
Are there any guidelines for swimming? Is it a matter of if you feel okay, just do as much as you feel okay?
Yeah, so swimming's a great exercise, particularly if you've got sore hips or knees, something like that when you're walking. The guidelines for swimming are basically the same sort of thing. If you're only moderately short of breath, then that's okay. And working out what stroke feels most comfortable for you as well. Because all swimming strokes, you're using bits of your arms, bits of your legs, and you're controlling your breathing, so it's a really good exercise to be doing. And in terms of duration, it's the same as walking and things, so starting off small and building up anywhere up to 20 to 30 minutes if you're feeling really enthusiastic and it's not tiring you out too much.
I've just finished 12 weeks cardio quarterly
Yeah.
at St George Hospital, but that's it. It's in. So what do I do now? I'm going to go back to the specialist and get another referral.
There's lots of programs now starting to come up that are maintenance programs. So a good way to go is looking on the Lung Foundation's website or contacting them, because they're doing a program which is called Lungs in Action, which they're basically assisting fitness trainers to increase their knowledge of heart and lung conditions so that they can run exercise programs for people with chronic disease. And they're starting to run more classes in community centres and things like that for people who've completed their initial course of rehab somewhere and want something as a bit of a follow-on. So they're a really good place to start. And also the Heart Foundation has a similar list of programs around.
Can I just say that if anyone living in the Central Coast Hospital has a heart failure clinic,
Yeah.
where you do, I used to the course 2011, and I go every week as a maintenance program.
Yeah.
It's all
Yeah, so most of the initial programs are Medicare funded. The Central Coast they do Gosford, Wyong and Long Jetty. I think they run clinics at all those, which is a really good way.
Brisbane water has all
Yeah. So lots of things around. As I said, if anyone wants to know about their local hospital, I can track things down for you. Okay.
So if you've got sort of low oxygen, like around the 88, 90 mark, so like you said, just exercise so that you're comfortable.
Yeah, so exercise is comfortable. We find a lot of people whose normal oxygen level is low. So we restrict you to keeping your oxygen level above a certain percentage in the normal range, you're never going to manage to do that and you won't be allowed to leave the house.
Yeah.
So for the most part, we get people doing things within that, slight to moderately breathless
Yep.
as the best way to exercise. And that's why doing a more formal program initially is a really good way to start, because they can monitor you and give you some guidelines about what is okay for you to be doing and how far you should be pushing yourself. And also sometimes for these programs, your specialist might recommend that your oxygen stays above a certain point or that your heart rate stays within a certain range. And that's a good way for us to keep an eye on it as well. And all the programs that run have access to, as I said, oxygen and heart rate monitoring for people who need it. Because sometimes people only need oxygen when they're exercise in order for them to be able to do a little bit more without getting as tired.
Yeah, well, I know when I do my 6-minute walk test, she drops pretty well when I start walking and that, but
Yeah.
they're not an oxygen pain or anything, but after I stopped, she comes back to normal pretty quick, which is, not too
Yeah.
bad.
So, and that's pretty normal for a lot of people here, I'm sure.
Oh, okay, yeah.
But now we're relaxing the guidelines a little bit, but as long as your doctor and the other staff looking after you say it's okay to do it. Okay, keep eating, everyone.